Hello, my name is Cameron Anders, and this is my presentation for evaluating advocacy. And my research topic for this class was children in poverty. That was my vulnerable population. So as we get into it, children in poverty are vulnerable for a number of aspects I've listed here, such as age, physicality, cognitive functioning, lack of resources. They're kids, they don't have jobs, they don't have the resources that adults have, they don't have the connections that adults have. Just some statistics for you to grasp the range of this children in poverty in the United States. In 2014, the United States had 15.5 million children under the age of 18 in poverty, compared to the 11 million in 2023. This was according to the State of America's Children Report. So as you can see, the numbers are declining, but the United States is a first world country. The numbers are much too high for a country like ours. Families of color. So these are just the population descriptions, such as the cultural aspects, the challenges they face, and the factors that contribute to their resiliency and why they are still pushing forward and still moving forward in this life. So families of color are largely overrepresented in the state of poverty due to income and wealth inequalities. Single-headed households, primarily single mother households, have higher poverty rates than married couple households, less support, less income, multiple factors within that. Children in poverty are at a much higher risk for experiencing challenges in their social, emotional, behavioral, and health arenas. One large factor that does contribute to the resilience of these children, which is no surprise to me, is supportive environments and supportive relationships, whether that be family ties or invested teachers, neighbors, coaches, or other influential people. Those have led to better outcomes in their lives. So that goes to show how important a supportive environment is for these kiddos. Oh, the National Association of Social Workers has many dispositions and values and outlines that social workers are supposed to strive to follow in their day-to-day work. Challenging social injustices can look like a variety of efforts. In this case, social workers are challenging childhood poverty while increasing community access to information and resources. And we're going to explore this a little bit more throughout my advocacy plan later, but the social work disposition number 2, the value is social justice, and the social workers are supposed to challenge social injustices, just like challenging children in poverty would be sufficient in that area. Social policy aims to alleviate or mitigate the hardships and stressors that come with social injustices, such as childhood poverty. So I found examples here, the federal, state, and local levels of examples that deal with children in poverty and how they are helping children in our country. So on the federal level, the Earned Income Tax Credit provides additional funding to low to moderate income families based on the number of children. On the state level, the Supplemental Nutrition Assistance Program, also called SNAP, it helps them purchase food from local grocery stores or farmers markets because food is amongst the major needs of people in poverty, families in poverty today. On the local level, Child Care Assistance Program, North Dakota has this, and I've worked with many families to help them get established in this, but it provides financial assistance in paying for childcare as long as the parent is showing that they are working or they're in a training program or an education program. I know there are families that are very grateful for this because daycare costs are skyrocketing and it's insane, and it's hard for parents to catch up financially when they can't afford the daycare and then they can't work, and it's a never-ending cycle. Thankfully, many of these policies are readily accessible online, but I can recognize the fact that not everyone has internet access, and especially for families in poverty, that they could not be affording the Wi-Fi, or they don't have access to a laptop or computer or phone or something like that. Internet applications are fairly easy to fill out, and they can speed up the application process, which can help immensely with someone that's in dire need of assistance or services. So that's a great positive to take away from this as well. But there are programs in place and people in place, and I work as a care coordinator in my current position, and this falls within the scope of my job to help people fill out these applications. And if they're not understanding how to navigate the internet, like that's something that I can help with. And so there are programs and there are people out there that can kind of help navigate this. So as you can see here, within my advocacy plan, my presenting problem is focused on my client and her family um, in poverty, needing resources, struggling to make ends meet, and there's some medical costs associated with their situation. So the aim of my plan is to get her and her family connected to resources and receiving food assistance and financial help while they work their way towards stability and out of their medical debt. As you can see here, the ultimate social justice related outcomes for the society is the hope that all children will be properly cared for and provided for and not remain in poverty. That's the dream, am I right? Moving along with my advocacy plan is a social media campaign that ties community efforts to immediate needs because social media is such a huge platform and should be utilized for positive outcomes, just this. So the two goals listed that you can see here are feeding 300 families and then collecting 150 pairs of shoes in the sizes of 1 to 13. Another important aspect of this campaign is the opportunity to invite community members to volunteer and join in supporting this cause because a call to action is vital to any piece of a campaign. And it draws attention to the campaign, it gets people talking, it gets them involved. So it's a huge aspect. Another important meeting of community needs is first being able to assess those community needs and able to recognize and identify what those needs are. So a sufficient way that you can do this is through a survey or a questionnaire. So I'm going to hope that this works and show you what mine looks like if it loads here. So it's a short survey asking about the current housing status, the needs that your family is lacking, talking about food, clothing for the children, financial status, and I left an open box, a couple of open boxes for members to elaborate on what's the biggest hardship that they're facing right now. Emotional well-being, because I think that's something that gets forgotten quite a bit in the struggling families is yes, they're paying attention to the physical needs and they're paying attention to what their kids are missing out physically, and they don't have the right shoes for the winter, they don't have a coat. But how is it affecting them emotionally? And then down here as well, giving them options for feedback for what do you think would help? What's going wrong with how things are right now, and how could this be different for you? And then I also left a spot for contact for an email to be followed up with. As far as administering it to the members of my community, I displayed it on one of our local Facebook community pages where anyone and everyone can ask questions and talk about community events and get feedback on things to improve our community. So I posted it on there. Many members are active and seeking out and giving information, and I had good responses from that as well. If I were to do it during the school year and not during the month of July and June, I definitely would have utilized the school system and sent it home with students to give to their parents and teachers to fill out either on their own behalf if they're parents or on behalf of some struggling kiddos in their class. I think that would have been very beneficial. So after administering the survey to my community via Facebook, I received a total of 14 responses, and the overall data showed that communities or families in my community were in need of food and clothing as the #1 identified need, followed closely by healthcare. So, and then when describing the financial status of their family, an overwhelming 57% of them stated that their financial status was unstable. So being unsure of where the income's coming from, it's not consistent, it's not reliable. And then common responses in the space for that I left for what would help you, what would benefit you, what could we change to make your situation better. A common response was making life affordable, making childcare affordable, making food affordable, because inflation, the costs are rising, everything is going up, and people are struggling to keep up with that if they're not getting raises at their jobs. And then also another common response was an adjustment in how the benefits are determined, because there are so many people that are teetering on that line of I'm not in poverty, but I'm barely above the line, or I'm close to it, but I can't get any of these benefits because I make too much money. I make $100 too much a month or something like that. So they're wanting the eligibility determination to be adjusted. And then as we look at evaluating advocacy, because it's an important part of any advocacy, ask how well did it work? And what I learned was I'm in North Dakota in a rural community, but I recognize that children in poverty is not escaped by our geographic location, and there are people in need here, and it's something that needs to be addressed, and it's something that needs to be looked at. So I want to bring to attention that our textbook states that there are two necessary phases of evaluating advocacy effort: observation and judgment. So within the observation phase, there's direct and indirect observation. To evaluate my advocacy plan from topic 3 that I showed you earlier, that big old map with my social outcomes and all of that stuff. This can look like attending the meetings between the social worker and the family in the medical facility, or meetings with the community programs. And then indirect observation would come from the logs of research, the activities, the advocacy attempts to talk with higher ups, to talk with policymakers, and any other relevant information that the client, the family, or the social worker might have made note of, and the evaluator would review these documents to learn about the process and what was attempted, what was accomplished, and what difficulties were encountered, and how they reached the outcome. Because looking at those aspects helps move forward and make plans for the next advocacy effort, and to help plan for those hurdles and plan for those road bumps to better set up for success. The judgment phase specifically looks at the outcomes and if they were achieved or partially achieved, or if some other unknown success came from that. The survey that I created would be considered a standardized instrument that measures life development and could be very useful if the clients were able to have the ability and the resources, and we had the knowledge that we were going to work with them, if they filled it out before services began, and like 3 months into services or 6 months into services, and then after the outcomes had been achieved. If they could take that same survey, I think that would be very telling of the quality of the advocacy effort. Lastly, I think a qualitative method of evaluation would be critical to evaluating this advocacy effort, because it is children and families that we're aiming to help, and hearing from them firsthand is going to give the most real and raw response. And it's their lives at stake, and nobody is a better expert at their lives than the clients themselves. So I think that's an important part of any advocacy plan. And here are my references to note. And thank you so much for listening. I don't know how to stop.